Honorable Sabina Chege, because of the limited debate time, let us avoid points of order so that we tell Kenyans what to do.
Thank you, Chair, and I want to thank Honorable Lilian Gogo for this motion. And I would say she has been consistent on this matter. I've seen her raise it before. Mr. Speaker, the problem we have with the implementation of SHA and SHI is about the clarity of the transition. Mr. Speaker, when the government decided to move from NHIF and now to the SHA, which is the authority, and with the benefits that we are being given by the chair from SHI to the emergency to the primary care, there was no proper communication and clarity on the benefits. As a former chair, Mr. Speaker, yes, NHIF had many challenges, but when patients visited hospitals, they knew what to expect. So a patient who was to go for dialysis, a patient who was to go for chemo, and who are majority of Kenyans, Mr. Speaker, they knew when they went to hospital what they were to pay and if they were to top up. Unfortunately, Mr. Speaker, when the 1st October came, I also became a victim. I had a patient in hospital, and even with an insurance, Mr. Speaker, it was very difficult to claim what was meant to be NHIF, which now had become SHI under the SHA authority. And so, Mr. Speaker, I would urge the chair of the Health Committee, these members, and I know even yourself interact with your constituents, it is the high time whether we can even be able to do a public participation.
The Social Health Authority was well intended to ensure that every Kenyan gets access to good health care. But I want to agree with my colleagues that there are challenges in transition. Just like any other program or project, there will be those teething problems when it's being implemented. And I think that is where we should focus. But there are also success stories. Honorable Speaker, I'm just from my constituency. The whole week, I was not in Parliament last week. And I did public participation. And one of the issues I was sensitizing my people on was on SHA. And they said, Mweshimiwa, we did not know. And the information the chair was telling us, we needed to sensitize and educate Kenyans so that they know what is SHA, what is the premium, how do they benefit, how do they pay. That information is lacking. And while we were doing public participation, one of my constituents, when returning back home, broke his hand. And we rushed him to hospital, to one of the private hospitals in town, and we were told we needed to deposit 100,000 cash money, which we did not have. I demanded that the patient is transferred to Bungoma, where we looked for a hospital. We were being told 70,000 we did not have. But before we went to Bungoma, I made sure the patient was registered with SHA. So we managed to get a hospital in Bungoma Hospital that accepted to admit this patient from Busia County, Teso South, and he was treated with SHA, and I only paid 25,000. And as I'm talking to you, he was discharged yesterday. So the problem is lack of information. The problem is equipping our hospitals properly. And Honorable Chair, Speaker, the Chair of Health, I want you to listen to me. We must put a proper budget to health so that we are not depending on donor funding. Diseases like cancer, in the last budget, we only gave them 250,000 for both recurrent and for them to establish cancer centers across the country. What can 50 million do? 200 million was for recurrent. So we need to equip. You go to Busia National Hospital, you find 3 mothers from the maternity sleeping on one bed. We must improve the facilities even as we work on improving the transition to SHA. The problem is in our facilities, equipments, and we need more doctors in our hospitals, Honorable Speaker. Thank you.
The Honorable Sarah Korere.
Thank you, Speaker. And Speaker, I want to thank my sister, Honorable Lilian Gogo, for bringing this adjournment motion. Honorable Speaker, as other speakers have said, SHA was well-intentioned. But Speaker, the trust deficit that it has brought about, the lack of stakeholder engagement is wanting, Mr. Speaker. And I say so because In every county, in every constituency, we have government officers up to the level of assistant chief. So, Speaker, if all the administrators were called and educated about this insurance fund and given the requisite information, these people are paid by government, the assistant chief, the ACCs, the DCCs. We cannot, depend on politicians who will politicize everything and want to seize the moment, even on things you had passed on this house, just to paint how bad some things are because they think they are on the other side of the division. And Mr. Speaker, as I stand here, my pay slip has been cut, and so are other civil servants. We feel the pain on the cut, but Mr. Speaker, will really enjoy when our people get services. Every member here, I'm sure every weekend, you are being called for some arambe, even when they know they banned arambes. You are being asked to contribute for some sick person. It is humanitarian. You can't start telling them arambes were banned. And Mr. Speaker, health is not a privilege to Kenyans. It is a basic human right. It should not be a luxury. We don't have the option of deciding whether Kenyans should have a proper health coverage. They must. It is a must, Mr. Speaker. So what am I saying? This thing requires a proper stakeholder engagement. We create proper awareness. The trust deficit, we should be honest to ourselves as leaders. For a very long time in this country, health has been a privilege of the rich. And I think that is what the president is trying to change. It should not be a privilege of the rich. It should be a right of every Kenyan. And Mr. Speaker, we know a healthy nation is a wealthy nation. If our people are healthy, they'll go about their businesses. They will contribute to the economy of this country. So, Speaker, it is not whether we are going to provide them with it. We must. And as a house, we must take responsibility. Those people, NHIF was marred by a lot of corruption. Even as we...
The Honorable Beatrice Elachi.
Thank you, Mr. Speaker.
I'm going to take a lot of time this side.
Thank you, Mr. Speaker. Mr. Speaker, I also rise to thank our sister, Dr. Lillian, but more importantly, for just giving me the opportunity, because last week I walked into the Committee of Health to get to understand. And Mr. Speaker, this health cover is the best for Kenyans, yes. But what we need to understand, and what the committee and our chair of health needs to understand, you cannot have a system where you appreciate the hardware, but you forget software is what will make the hardware work. And that is the crisis we are in, Mr. Speaker. One of the things I need them to come and explain to us, in all insurances, there is a cap. In Shif, you don't have a cap. So if someone is paying based on your salary, you are just paying. And those are some of the things Kenyans are feeling. They need more explanation. There must be a cap on this. Mr. Speaker, the other thing is that it is time for all of us members of parliament to put a desk in our constituencies. Let us register our people through our community health workers so that we see these numbers, so that we now get to understand, and even as ourselves, to have a tent here outside here in our own bunge, for us also to know whether you have registered, yes. But if I go on my phone, it does not show me that this month I was able to contribute the money. So how will I know that I'm contributing? So it needs that system analysis is where there is a big problem. And Mr. Speaker, there is worse problem in the digital one, where we have all these multi-agencies that have brought us into this crisis. Yet we bought a machine for nearly 1 or 4 billion. We should not be in this crisis. We should be now having a health cover, and we should be now celebrating that we have a health cover for everyone, but not going into the crisis we are going in. And then we find putting our president into a lot of challenges because of what we have done. And yet it is just in the Ministry of Health where we have that confusion, Speaker. And this is the time that they must come here through a Kamkunji, realign everything, tell us how the claims management system works, tell us very well how the counties are going to, they are benefiting, yes, but then how do people register for their county hospitals?